welcome to the Rare Wellness Podcast. Wellness is a rare treasure hidden in the maze of daily challenges. In this podcast, we will illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 5 minutes or less. I'm your host, Dr. Jamie Lewis, and today we'll dive into the fundamentals of regenerative medicine with my colleague, Dr. Howard Grattan. The podcast is brought to you by Northwest Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.nwc4rm.com. Before we begin, a quick disclaimer. This podcast is for educational purposes only, not intended for medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. Today, we're joined by Dr. Howard Grattan to explore a field that's revolutionizing medicine. Dr. Grattan, let's start with the basics. What exactly is regenerative medicine?
Oh, thank you, Dr. Lewis. I love explaining this because it's such a paradigm shift in healthcare. Regenerative medicine is about harnessing your body's natural healing abilities rather than just managing symptoms. Instead of masking pain or inflammation, we're actually helping the body repair and rebuild damaged tissues.
That's a great distinction. How would you explain the difference between the approaches of traditional medicine versus regenerative medicine?
Well, traditional medicine often focuses on symptom management, the pain medications or cortisone shots. While these have their place, regenerative medicine goes deeper, adding to the root cause or getting to the root cause of the problem. We're not just reducing pain, we're actually helping tissues heal and regenerate.
Let's break this down a little bit more for our listeners. What are the core pillars of regenerative medicine that makes it different?
There are three key areas that we focus on. First, we have lifestyle intervention, the foundation of everything we do.
Before we consider the advanced therapies, we always want to optimize nutrition, sleep, exercise, stress management. These factors can make or break any regenerative treatment. Dr. Grattan, what about the second pillar?
The second pillar is platelet-rich plasma, or as we created super concentrated platelets, making even higher, more effective doses. And this is, the platelets are the body's main signal for when there's an area that's injured, like a cut or a laceration. The platelets are the first to get there, and they signal initially the inflammation to attract the white blood cells to fight infection. But then later, as they slowly are releasing their growth factors, they're recruiting the stem cells from your bone marrow to heal up and shrink down that scar tissue.
And that brings us to the third pillar of regenerative medicine, is using mesenchymal stem cells that are found in bone marrow concentrate or adipose tissue to help heal and repair. You want to speak a little bit on that?
Yeah, we call those generally cell-based therapies. And our body oftentimes has a large storehouse of these mesenchymal stromal cells or mesenchymal stem cells, whatever you want to call them, in the pelvis itself. And we can just take those, harvest them, concentrate them down to levels that would be seen in a much younger person and heal up much faster and more effectively.
So let's take a little bit of a deeper dive into some practical applications. Where are we seeing the most success with these treatments?
We're seeing remarkable results in several areas. In orthopedics, we're helping patients avoid surgery for conditions like joint arthritis, tendon injuries. In chronic pain management, we're addressing issues like degenerative disc disease with lasting results. Even aesthetic medicine, these treatments are revolutionizing how we approach aging.
What excites me the most about this field is it's constantly evolving and developing. Like we were at a few weeks ago, the Interventional Orthopedics Foundation. What excites you most about this field?
The advances in precision diagnostics and targeting treatments is incredible. We can now be much more specific in our approach, using advanced imaging and biomarkers to guide treatment. What's really revolutionary is understanding how these treatments affect longevity and overall health.
Could you elaborate a little bit more about the connection between regenerative medicine and longevity?
Well, chronic inflammation is one of the biggest drivers of aging and disease. By using regenerative treatments to reduce inflammation and promote cellular health, we're not just treating specific conditions, we're potentially extending health span and improving overall quality of life.
And for our listeners who are intrigued by these possibilities, what would you recommend as the first step?
The best place to start is with a comprehensive evaluation. At our centers, we take a personalized approach looking at everything from advanced diagnostics to lifestyle factors. This allows us to create targeted treatment plans that address each patient's kind of unique needs.
I think that's great. Thank you for joining us today on the Rare Wellness Podcast. If you found value in today's episode or learned something new, please subscribe, leave a review, and share this podcast with a friend. Your support helps us to continue to provide free content to empower you on your journey to better health. This is Dr. Jamie Lewis reminding you that your body holds incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock your full potential and live your best life now. Until next time.